How does diet affect if your child is diagnosed with autism? We're going to discuss this in our session with Greer McGuinness, a biomedical clinician with over 15 years of experience in the medical field. Greer is registered dietitian and certified lead therapist with extensive experience in helping those with food allergies and intolerances. She developed a passion for alternative medicine after her son was diagnosed with autism in 2016. I'm Amita. I'd like to introduce all of you to Greer. Welcome, Greer.
Thank you. I'm sorry my video isn't working, but it's nice to be here today with everybody. So my name is Greer. As she says, I am a dietitian. I've been working with children with autism spectrum disorder, ADHD, PANDAS for the past couple of years, and really trying to narrow down those underlying causes of what could be really impacting their life and their nutritional status. So autism spectrum disorder refers to a really broad range of conditions. So not everybody's going to be the same. Diagnoses of girls and boys are very different. The criteria are separate. Girls are usually misdiagnosed or diagnosed later in life, but boys are right now 1 in 32 and girls are 1 in 144. And the rate continues. Every year it keeps going, getting smaller and smaller. The signs of autism can start as early as 2 or 3, it can be diagnosed as early as 18 months. They do have really strict guidelines for autism. It's usually the issues with social skills, repetitive behaviors, speech, and nonverbal communication, but that's mostly in boys. Girls are very different. Girls usually are typically the opposite. So autism can also incorporate OCD and sensory processing disorder, which are both different types of behaviors that can come along with autism, and it also can exacerbate it. But autism is also based on 3 components. There is a genetic component, there is a metabolic component, and then there's an environmental component. So autism is not just a genetic abnormality. There are other abnormalities, and we don't always know the underlying cause unless we start doing testing. Next slide, please. Typically, every patient that I see with autism has some type of feeding disorder. Either it's selective or very restrictive eating. So anywhere between 60 to 89% of children are selective eaters. So they don't like certain foods, they don't like certain textures and tastes. Certain things need to be crunchy, certain things need to be soft. So it really depends on your child. It's not cut and dry, and every child is going to be very unique and very, very different. So when I usually see a child, we have to go through a whole entire intake and find out what their diet is, what they're eating, because they usually don't like to expand. So about 89% of reports of children are unable to even sit for family meals. Either they have, the OCD, the ADHD, they can't sit, they can't, being around other people. And 56% eliminate previously eaten food from their diet. So even if you sit down for family dinners and you try to change things up, kids could say they eat chicken every day for a couple of days, then all of a sudden they won't eat chicken at all and refuse it. So it's really hard sometimes to keep up with the picky eating and the selective eating. So I do a lot of work with people in picky eating and trying to make your child feel a little bit more comfortable with sitting at the table, trying new foods or trying previous foods, and just continuing the process. So the issue is, even with kids that are selective or restrictive eating, children with autism generally still achieve the normal height and weight of neurotypical children. So a lot of pediatricians miss the fact that your child could be deficient in certain nutrients because they're hitting their milestones, they're hitting the charts, and it doesn't look like they're malnourished. It doesn't look like they're losing weight. So they don't really know. So they're eating, but they're usually eating only specific foods, certain types of foods, and they're usually not the most nutritious foods. So that's what leads to nutritional deficiencies, and we don't usually see it until we actually test for it. Next slide, please. So I do micronutrient testing, and there's a lot of testing that usually goes along with autism spectrum disorder. And it's always a good thing that if you have a child that's a picky eating or selective feeder, to find out what supplements that they might possibly need, because every child's different. So a lot of this is all science-based. This is all nutritional deficiencies and low levels that have been recorded in children with autism and ADHD. So you'll see, you know, your B12s, vitamin D, vitamin E, folate, biotin, pantothenic acid, calcium, and then you'll see a lot of times low levels of magnesium, selenium, chromium, iodine, lithium, choline, fatty acid imbalances. And we know malnutrition deficiencies can result in like scurvy, vision loss, and iron deficiencies, but it doesn't mean that these other types of nutritional deficiencies won't impact the body. You know, it could be from, you know, disrupting sleep, excessive behaviors, violent behaviors, all could actually be an underlying cause of nutritional deficiency, and we just don't know. It doesn't also mean that they're not nutritionally, like, feeding, you know, getting all their nutrition from food. It also could be a stomach issue where they're not actually able to absorb any of these nutrients that they're eating because of GI issues. So it goes twofold, where it could be related to food, but it also could be related to the gut. A lot of the times when you see a practitioner, if you have a child with autism, you have to look at the child as a whole, and you have to look at what they're eating, the nutritional aspect of it, and also what's possibly going on in their GI tract. Next slide.
What is the trigger point? What is the trigger point that a parent can think like, oh, my child is, you know, what would be that?
So typically, one of the biggest things I notice with children is they have a very extended stomach. That could be bowel issues. So if your child has a very extended stomach, it could be GI issues. If you know your child is prone to constipation or diarrhea, that's usually a number one thing where I want to correct what's going on in the gut. And that sometimes can be why you're not absorbing the nutrition aspect of the foods that you're eating. Other things are making sure that your child is eating a variety of types of foods. And if we can't get there first, we have to try to find supplements that work best for the family and for the child. So we start low. There's a ton of supplements out there that you can hide in food and, hide in their waters and things like that, or juices. So it's trying to, every child is so individualized. I wish I could give you just like such an easy answer, but every child, I have to customize their nutrition panel, their supplements, their regimen, so specific to them. So nutritional deficiencies could be associated with functional issues, behavior impairment, communication problems. You know, I've seen kids start taking specific supplements that they needed because they were low, and all of a sudden either certain behaviors stopped, they were able to communicate better, function, sleep better. So micronutrient testing is an amazing thing. It's easy, and it's something that can be done at home with certain practitioners like myself, and to try to pinpoint exactly what your child needs. And that's the most important thing, because we know any type of nutrition deficiency can impact the brain. And making sure that the kids start out early on with the right track, and making sure that they, usually you'll see children be more picky between the ages of 2 and 3, and that's for neurotypical children, just because it's a control thing. But children with autism and ADHD, their picky eating goes usually around 1 to 2, and it continues. So that's where it's a problem, and that's where we need to address it as early as we possibly can, because we don't want to wait till they're older and they're still having issues, either trialing foods, food textures, food issues with it gets really hard when they get older. Go ahead.
I can't see you. That's all we have, all the slides we have. We can open it up for questions. We see quite a few people who are attending the Zoom. So you can come up with the question. Maybe you can, Greer, maybe you can narrate a story of your son, because I think that's very touching and that will resonate.
Yeah, sure. So my son was diagnosed in 2016 when he was about 2. He was diagnosed with moderate autism with severe verbal delay. So he really did, he was speaking and then regressed and completely stopped speaking. We did a lot of interventions. I took him to multiple doctors trying to find out what happened and why he regressed, and, you know, trying to pinpoint like what had happened. And, you know, no one really could give me an answer. So I started doing everything I could as a parent. He was getting OT, PT, speech therapy, feeding therapy, psychological services. I mean, any services I could get him, I would get him. And we were on this path for about almost 2 years, and we were making very, very minimal gains. So I started doing a lot more research. I went back to school to get my master's so that I could really dive deeper into health at a higher level. And I started finding more about functional medicine and biomedical medicine. So I literally went on a journey. I found an integrative doctor who I love to this day. He is one of my favorite doctors near where I live. And we started this journey with my son, and every time I went and took my son to a doctor and we did blood work, all of his blood work kept coming back normal. And I'm going, something's not right. You just have this inkling as a parent that something isn't right. So when I went to this alternative doctor, we ran a whole different panel of tests. And for the first time, all of his levels started coming back abnormal. He tested positive for Epstein-Barr virus. His vitamin D was low. His omegas were low. His adrenal glands were low. His liver function wasn't right. His methylation pathways were not flowing and functioning correctly. So once we started really tackling all of his underlying causes, his GI issues, his everything, my son now is borderline autism, and he's only has a slight verbal delay. So he's likely going to be testing off the autism spectrum within the next probably year or 2. So we've done a lot. So
how old is he now, Greer?
He's 6.5 now.
Oh, he's 6.5. And this has been going on since he was 2. That's what you mentioned, right?
Yep. So it's a long journey. It's a lot of up and downs. It's a lot of tears. It's a lot of trying different things and different methods. But it can get you good results. It really can. When you really try to pinpoint and what you need to look for now I know as a clinician what I should have been looking for years ago. I should have been using these biomedical testings that the doctors told me, that they didn't know anything about, to really find out what was underlining of what was going on in my son.
So we have questions coming up. Unfortunately,
sure.
You can't figure out how to turn on your video.
No, it won't let me. It keeps telling me I'm not allowed to.
Oh my! See, I see a little pop of black, and then I don't see you. I mean,
yeah.
I would love to see you. Okay.
I know. I'm so sorry. It just keeps telling me no, I'm not allowed to.
Okay, we have quite a few questions coming up. All right, so someone is saying, will this be available afterwards, just in case I have to leave? Yes, this is, we are recording it live. All right, so someone is saying, let's see, thanks for the nice presentation. I just wonder what are the main food types that autistic children should avoid, if there is any.
So that's actually a really good question. So typically it depends on the child. A lot of kids react really negatively to anything with dyes. So like red dyes, yellow dyes, blue dyes. So anything that has dyes and anything that really has any type of chemicals in it. So you really try to, with like high sugars, things like that, so you typically, if you're going to avoid specific things, it's always the red dyes. It's always high amounts of sugar. That's like for my first part, because
Like candies and all that, those have dyes.
Candies, yeah, a lot of candies and stuff will have red dyes and sugar. Sweets, and you can use alternative, you don't want to use real sugar. You can use like agave, you can use like coconut sugar. You can use all different types of alternative type style sugars.
Okay. Hope this answers your question. Any follow-up to this question? Okay, that looks like fine. All right, so the supplements, you said that the supplements that you recommend. So are they generally safe for the kids? So
there are tons of supplements now geared for children with autism specifically. So it just depends. Some of my favorites, if you want just like a vitamin type supplement,
I don't know. This is a question that has come up, so someone's asking this question.
Yeah. So if you're
2 or 3 supplements or something, that are common.
Multivitamin wise, I really like Smarty Pants for a lot of kids who are sensory, but also like the gummy aspect of multivitamin. Renzo is a new one that I've just started looking into, and I really do like their supplement so far. My Spectrum Heroes is another good one, and that's geared towards kids with ADHD and autism because it has extra types of supplements in them that particularly work on brain function. So okay. My Spectrum Hero is My Spectrum Hero. It's a powder, and you can mix it in any type of drink. You can mix it in food. You can usually cook with it. And that one I really like a lot too.
But you don't, I mean, generally, are these available in supermarkets?
These are available online. All of these are available online. Smarty Pants is typically, I get it at Target. I see a lot of parents get it at Target. Okay. Renzo has, I think online, you could buy it right online. And I don't know if they have them in certain stores yet. Okay. And My Spectrum Heroes I buy directly from online.
Okay. All right. So someone is asking, are you aware of any nutritional issues in autistic adults?
So you can, even adults like us who are not autistic can still have nutritional issues. So don't just think that neurotypical adults are out of the, can't have nutritional issues. We all can. Typically, in the United States, most adult women and most adult men are actually low in vitamin D. Typically, I see a lot of CoQ10 low issues with when I do micronutrient testing for adults too. So yeah, I see a lot of nutritional issues with everybody. It's not just autistic adults, but it can, especially if you're carrying over those food issues into later life. So if they're still restrictive eating, like I just had a 17-year-old kid a couple weeks ago, and he still is struggling. His parents tried to do feeding therapy when he was younger, and then just the doctor kept saying, oh, he'll grow out of it. He'll grow out of it. And he never did. So now he's 17 and he like chokes and gags and vomits with food, with trying new foods still at 17 because of his anxiety that they never technically really addressed when he was younger. So those types of feeding behaviors, especially with children with sensory and autism, can continue if it's not treated and if it's not, if it's not addressed early on.
So what are you, can you share this case a little bit more? Or I don't know.
Yeah, so no, I can share as long as I don't share the name, it's fine. The kid is 17 now, but when he was younger, he had a lot of feeding difficulties and an issue with his esophagus. So he was a little bit more delayed with eating.
Yeah.
So his parents did bring him to somebody. They don't remember who it was when he was younger. They don't believe she was an actual real professional feeding therapist. And they thought it made it worse. He was very upset during the sessions. He was crying a lot. So they just kind of pulled him. They talked to the pediatrician. The pediatrician said, he'll grow out of it. All kids go through this, because it was still around the age of, when kids are young and control and not wanting to try certain foods. And they just thought he would eventually grow out of it. And now at 17, he still is having high anxiety with trying new foods. He fears that he's going to vomit. He feels it's going to get stuck. So it's hard for kids who didn't get it addressed early on, because now he's 17, you know, he wants to eat and hang out with his friends, and he can't try new foods. He can't really eat around them. He gets, you know, anxious. So we're working with him, trying to decrease his anxiety so it's not fearful anymore for him to try all new foods.
Okay. So there's a question about taking milk and gluten that might worsen in the food digestion in autistic kids. What's your comment on that?
So milk and gluten can have almost like an opioid effect on the brain. It's the mechanism between the gut and the brain where you get that euphoria feeling, like a drug feeling. So if the child, or even any type of child, autistic, not, and an adult, if they have an issue with digesting and they don't have the enzymes and they don't have the ability to break down those particular food items, it will cause issues not only on the gut, but on the brain. So not every autistic child or regular, you know, child with issues needs to remove milk or gluten. Does it help and benefit some? Absolutely.
So it's a case-by-case basis, so to speak.
Yeah, so I do the food sensitivity testing, the MRT testing is something that I do. Typically, we do cut out dairy right away, because dairy is always typically a common cause of many people's issues, either food sensitivity wise, where it be a slight allergy, tickle nose, sneezing, watery eyes. It can still manifest as a milk allergy. Mm-hmm. And then it could also make things worse, where it hurts the gut, it causes diarrhea, it causes eczema. So it could be that as well. It just depends on the child. So typically we always usually remove milk, and then gluten, depending on the child, depending on the severity of their food issues, we try to remove as much gluten as we can typically.
Okay. Okay, any follow-up question on this? You can type it in the question and chat. Another question that's coming up is saying, would taking antibiotics affect long-term nutrition?
Absolutely. When you take, so in the gut, your microbes, you have hundreds of millions of microbes in the gut, both good and bad. When you take antibiotics, you kill a lot of good and bad bacteria that are in the gut. A lot of times you're not, you know, people usually don't take a lot of antibiotics over a long period of time. A lot of kids that I've seen early on with autism have had rounds of antibiotics. My son was one of them. He had recurrent ear infections, I want to say between 7 and 8, between the time he was 1 and 2. And I didn't question the doctor of putting him on rounds and rounds of antibiotics. And then that destroyed his gut. So usually with children, we try to keep them off antibiotics as much as possible. Obviously, if they're, you know, there's a reason, if they have strep throat, you know, something with a strep infection, you never really want to not give antibiotics for, because that could be something very serious. But we try our best to avoid antibiotics. Antibiotics for long periods of time can destroy the gut, and it can destroy the good bacteria, allowing the bad bacteria to take over. Once that happens, you can then lead into many other types of issues. So there's really, unless you have an underlying condition where you would need to take a low dose antibiotics, which I have seen before, or children with PANDAS who need specific antibiotics to treat bacteria in the gut, that's short term, but long term will affect nutrition 100%. It will affect how you absorb your nutrients.
But what is the alternative to antibiotics? I mean, how would you?
It depends. I read a study not too long ago that pretty much at least 70 to 80% of kids under the age of 2 has at least 1 round of antibiotics.
Yeah, that's a staggering figure.
Yeah, and it's hard because a lot of times I think people just give antibiotics when they just don't have an answer. Oh, ear infections is a typical one that we give antibiotics for, and a lot of the times antibiotics for you can't give for viral ear infections, and that's what a lot of the ear infections are for kids, are viral, and antibiotics doesn't work on viral, it only works on bacterial. Mm-hmm. So, you're giving an antibiotic and hoping it might work, and we just don't know. So just depends.
Okay. All right. Any other questions? Just going through all the questions. I just want to make sure I've taken all the questions the audience is asking. This is great. Any more questions before we wrap up?
And if anyone has a question in the future, they can always reach out and ask me.
I can just put in the chat also. Well, there is a question here. Sorry. All right. There's another question. You can if you can't think of any questions right now, I'm putting our email and we can send it to Greer, no problem. You can send it to care@nourishdoc.com. Okay, so there is a question, Greer. What is good for speech? I don't understand.
So I think what they mean is a lot of times with children with autism, they either have verbal speech delay, they have apraxia. Gosh, that's a tough question.
Okay.
Yeah, it depends on what the underlying cause is. It could be an environmental factor, it could be heavy metal factor, it could be a gut issue, a brain issue. It really just depends on the individual child and person.
Okay, so there's no one therapy.
There's no one. It's I strongly still do believe in doing the therapies with children if your child is diagnosed, to get them the OT, PT, speech. All of that benefits the child greatly, along with biomedical intervention. So it's really important to have a nice cohesive group working with your child. So it's multi-interdisciplinary.
So what is it called? Speech therapy, you said? Can you clarify?
Yeah, speech therapy, occupational therapy, and physical therapy. You also have ABA therapy and things like that. And, we've done them all, and we've had really great success with, doing them plus biomedical interventions.
I see. Okay. Hope that answers your question. Any other follow-up question on that for the speech? All right. Any more questions? Okay, I don't think any more questions are coming up. Any last comments or any feedback on the session? You're welcome to put it in chat as well. We are trying to bring a lot of value and science-based discussions to every week. All right, so I think you've answered all the questions, Greer. It's too bad we couldn't see you.
I know, I'm sorry. We'll have to do this again in the future so I could do it.
Absolutely, absolutely. With that, I'd like to end this session. If there are any last comments, you're welcome to say something. All right. So I'd like to end this session. Thank you so much, Greer, for joining us.
Thank you for having me.
Yeah, and thank you to all the attendees for all the questions. We have written our email here. I do see one more question coming up. Okay, so how did you manage them to take supplements? Okay, that's a question that has come up.
That's a really good question.
I was just wrapping up, and then I knew I always wait for a moment before I wrap up.
So every child is different, so you have to work with what you can with the child. So my son we started doing a chart, and we started working towards goals. So, after he tried to take a certain amount of supplements for a certain amount of days, he could pick out of a treasure box. We could go to Chuck E. Cheese. We could, you have to still make it a reward because your child is still working towards something. Typically what we did at first was start mixing the supplements in specific food items so that he would be able to take it and he wouldn't know about it. I did a lot of digging on finding all those supplements that had no flavor, no taste, that mixed with water, mixed with a food, because he was so selective. And if he even hinted towards something new, it would have a meltdown. So you have to, you know, I've done things that are lotions and transdermal patches. So it really just, whatever you can work with your child is what you can, you know, need to try to figure out and do. And that's what I usually work with parents trying to figure out too. How am I going to get your child to take X, Y, and Z supplement that they need to take in order to, you know, do well? So that's always really hard.
Okay. Any other comment? All right. Okay, I think this is an amazing session, a very engaging session. We have to have you back when we can see you.
I know. I keep clicking the video and it keeps going, failed to start the video camera. Please select another video camera in settings. So I have no idea.
Well, even though we can see you, but I think people got a lot of value out of this session. With that, I'd really like to thank you, and thank you all of you for watching.
Thank you.
Yeah, have a great Sunday afternoon. Bye-bye now.
Bye-bye.